that. So the Board of Health meeting for Monday, January 24th, 2022, 6 p.m. is officially started. This is a recorded meeting being held remotely. Votes will be taken through roll call. As we do have some board members with scheduling things tonight, I just want to do a quick pause to see if anyone wants to make a motion regarding our agenda. And if not, we'll just proceed with our agenda as planned. So first on our agenda are public announcements, announcements from the health department. So turning that over to our health department, please.
Good evening, everyone. I'm going to give a quick case update. We've had a significant fall off to 232 cases. That's still more than we had in any of the previous peaks. But as I said at the last meeting, it appears that we had peaked, plateaued, and now are decreasing, which hopefully will also lead to decreases in hospitalizations to take some of that strain off. We're having some continued staffing issues, and they are going to continue for this week. So if you called and you need a trash barrel replaced or a lid replaced, you might have to wait till next week to get that done. So bear with us. We have vax appointments still available for boosters. If you want to start the series, boosters for 12 and up, all adults, all of the appointments are on our website. So if you want to schedule one, please do. And I want to say thank you to Tom Thibodeau at the Abington and Brockton Housing Authority. They hosted us for a clinic on Friday for all of those people who live there and have some problems getting out to the other place to get the shot. We went there and gave a lot of those residents boosters. And we did a little over 40 or around 40 12 to 17-year-old boosters today at the school. So thank you to the school staff for both hosting and assisting in that. And on a personal note, I have resigned this position, and this will be my last Board of Health meeting. And Friday will be my last day as an employee of the town of Abington. So thank you to everyone who supported us and who helped with everything and helped with all of our vaccination efforts and all of our efforts through the COVID pandemic. And that's all I got.
Thank you. Any discussion points, feedback, questions, or other concerns from any of our board members?
Yes, I do. So, Marty, has the state of Massachusetts adapted the new CDC guidelines about the 5-day and 10-day quarantine period?
Yes.
How is Abington counting the difference of 5-day to 10-day periods? As you had told me, you can't count that.
I have no idea what you're talking about.
So how are the numbers?
So there's two different things here you're referencing. You do know there's a difference between isolation and quarantine, right? Isolation is one thing, quarantine is another.
Okay. The 5 and 10-day isolation period.
Yep, we've been doing that since the Mass DPH had adopted it. When the day that they adopted, we changed our protocols based on their adoption of those new updated recommendations.
My question is, how you have stated that you cannot call people to find out whether they are asymptomatic and symptomatic.
Again,
So
because that
now,
doesn't matter. You don't have to be
Can I finish,
asymptomatic
please?
and still be infectious.
Gentlemen, let's do one question at a time. Let's the board like to recognize Andrew, please, to finish the question.
Sure. Sorry.
Thank you, Christina. With the health department saying numerous times that they cannot call these people and keep track of who is symptomatic and who isn't symptomatic, now that it matters to the CDC, how is the Abington Health Department counting whether somebody is asymptomatic and isolating for 5 days or symptomatic and isolating for 10 days?
I guess I'm confused by the premise of the question. Is your expectation that every single positive case in Abington get contacted now? Because that is not the requirement, nor is it the recommendation from the CDC or from the Mass Department of Public Health.
Okay, so my question, I test positive and Melissa tests positive.
Yep.
I get sick and show symptoms. I have to isolate for 10 days. Melissa doesn't show symptoms. She can isolate for 5 days. You're counting the active case numbers. So in 5 days, Melissa is still asymptomatic. She can no longer isolate and then be considered an active case. While I, being sick, is still considered an active case. How is the Abington Health Department differentiating between the two active cases for asymptomatic to symptomatic?
So we're not, because it's a glorified oversimplification of the actual requirements. And we sent out a mailer on the our constant contact that goes over isolation quarantine guidelines. If you haven't signed up for that, I highly suggest you do. And all of that information is already out there. And as I've said ad nauseum, if you are a positive case, you are still infectious regardless of symptoms. If you don't have symptoms, you are infectious. If you do have symptoms, you are still infectious. So on day 5, if you have symptoms, but they have progressed to getting better, you're allowed to go back out into the world on day 6 with a well-fitting mask. And again, that was mailed out on this flow sheet that we sent out on our constant contact. So there is no expectation in this town or the state that every patient get contacted who tested positive. And it is incumbent on the person to do so. We update the numbers as best we can based on timeframes. So there is no expectation that we contact everybody. And I thought we made that clear maybe 2 meetings ago. And if not, I'm sorry, but it's on that flow sheet. And if you haven't got it because you didn't sign up for the constant contact or read the email that I sent, I'll happily send you another copy.
Okay, so even though that's fine, that's what you have said. My thing is, how many?
It's not just I said.
The
Hang on.
CDC.
It's not just I said. It's the CDC and DPH. We are to focus efforts on certain areas. And now that that focus efforts has gone, we're still trying to figure out exactly what's next. And there's a call tomorrow to figure that out.
It just makes me wonder how many of these 200 and what did you say, 293 active cases right now?
It's on the link that you have. So if you want to go to
I understand that. I'm just,
and it's on page. Our website is updated as frequently as we can. And right now it's 232.
Okay. It just makes me wonder how many of these 232 active cases are not considered active by the CDC new guidelines that Abington is not following now.
I think you are seriously confused about that. And if you want to like talk about this offline to learn it, I'm happy to help you. But if you read the flow sheet that we sent out and read the CDC and DPH guidelines and that training that I sent you at the BU Public School, School of Public Health, and all those links and all of those studies and all of the recommendations, maybe that'll help you understand it. Because if you're in isolation or if you're a test positive, we have to count that as a positive case, regardless of symptoms or not, because you are infectious for a period of time.
Okay,
So
that's fine. And
we are counting those tests positives as best we can.
I understand that. I'm asking, how are you making the numbers reflect when somebody that is asymptomatic has passed their 5-day isolation period? It's a simple question, Marty.
It does not matter whether or not they are symptomatic for the case count.
It does for the CDC now, Marty.
To you,
it is the new guidelines.
Gentlemen, please.
I wish you the best of luck in your future endeavors with that.
Gentlemen, please. There is, speaking as the chair, because at the end of the day, we all do have the same goal here. We are looking at the same issue very differently. If I can make a suggestion, one thing that we do have that's available to the public that both Marty and Andrew, you're both referencing, is our COVID numbers on an Excel sheet. One thing this spreadsheet does not have, and Marty, I think you'll remember we talked about making this public, and one of the questions the board had a while ago was the interpretation of that information. It is a fact that the current link that is available to the public that Andrew's referencing, that you're referencing, does not have a legend. It doesn't actually kind of bring it down into like a layman's terms on what like a case count is versus this or that. So if you're not following our board meetings, you might not understand when it just has a hard number for daily cases, is that asymptomatic, symptomatic. I know this doesn't, Andrew, get to what you're saying. I understand that, but it might be a step in the right direction if we were to add a legend on what these different tabs are actually representing. And then the log.
There is a legend at the bottom where it says total cases. It says total cases, current case count, test
Yep.
positivity rate, our test positivity graph there.
I
And
see
I
that.
don't believe, if I'm not mistaken, and I'll look this up to make sure, there is actually no obligation for us to report active cases in town. This is a tool that we use to help people make decisions, and we do it the best we can. So if there's a difference between the 5 and 10 day, well, we will do our best to make sure that it gets updated, whether or not it shouldn't matter, but we will do the best we can.
By you not differentiating the two, you're inflating the numbers.
I disagree with that oversimplification, but you're free to think that.
That's fine.
Okay, I'd like to move on, gentlemen. I think Kevin has been pretty patient, and I don't know if we've already addressed.
I just wanted to, Marty, we appreciate, all your efforts over the last 2 years and guiding the town through the pandemic. I think, you and your team have done just a great job. And I personally, and I know I'm speaking for majority of the town, appreciate all the efforts that you have given in your time that you've served here for Abington. So I do appreciate it. Thank you.
Thank you.
And Andrew, this does include you if you have a question on a different topic, but any more questions, comments, or feedback to the first part of our agenda from the health department?
I'd also like to thank Marty for his tremendous work in getting us through the pandemic. Thank you, Marty.
Thank you. I'm around if anybody needs anything. Still live here.
All right, anything else from the board before I move on to topic 2? All right, thank you. Thank you very much.
Good night.
Thank you, Marty.
I didn't realize you were giving the open window to do it right then. I thought you were gonna take a roll call. I would like to make 2 motions as far as the agenda goes. 1, to move up COVID safety measures to now before the tattoo regulation. And then I would personally like to make a motion to end the meeting at 6:30 when Marty and myself have to leave. I know you need 3 people to have a meeting, but the chairperson's not here, the health director's not here, another member's not here. I think it would just be best if we ended the meeting at 6:30.
We want to do 1 motion at a time, Andrew, kindly. So if you'd like to make your first motion, please.
I would like to make a motion to move the COVID safety measures up until now in front of the tattoo regulation.
All right, do we have a second?
I'll second the motion. That's fine. I don't have any problem discussing it.
Okay, the motion passes. I'm sorry, Melissa.
Sorry, I have a question before we do that. Were the tattoo professionals invited to the meeting tonight?
Yes, they were. I did connect with Aaron. He confirmed he had invited them. And when I talked to him this afternoon, he said that no one had responded.
Okay, thank you.
So the motion passes to move the COVID-19 safety measures ahead of the old business. And then Andrew, I believe you had a second motion.
I actually have a third now. I would like to make a motion to table the tattoo regulation if there are no tattoo artists on the
There's a
Zoom
motion on the
call
floor. Yeah, excuse me, Andrew, but if there's a motion on the floor, I believe we have to act on that motion first.
Okay, thank you, Kevin. I
Okay.
did ask that, so we'll act on the motion.
I'll
So
do that other one. I would like to make a motion to end the meeting at 6:30 when I and Marty have to both leave.
I believe we have to act on the first motion before we can address that.
Oh, I thought you, okay.
As I understood it, if I understand it correctly. So the motion passes to move the COVID-19 safety measures up in the agenda. So at this time, we'll open up our discussion on the COVID-19 safety measures. So to our discussion, I'll start for that because I do have something to say on that topic. On our safety measures, so last week, and I'm looking off screen, I just have my notes here. So we amended the advisory to include a notification that the healthcare system capacity was high, and we also amended the advisory recommendation for remote work. So what I would like to do as part of discussing the safety measures is talk about how to stand that down when appropriate. The health department had supplied the Mass Government COVID-19 link with the dashboard. When we had passed the advisory last meeting about the healthcare system, the bed occupancy rate was at 94%. Today, the most current data is from January 21st, and it's at 93%. So it's gone down like 1%. From really, really early discussions in 2021, and I think Melissa and Andrew, this might be before your time, we talked to the health department about bed occupancy. And as I recall, the ideal state was 85%. So long story long, my question to the health department is, what is a good data point that we can use as a board when to stand down that advisory about healthcare capacity? Is it still 85% and we can stand that down, or is that just no longer the right data point? And Chris, I understand that you're on the call, so I hope you could respond to that, or if you're not able to respond today, if you'd be able to get back to the board with an answer at some point.
Yeah, we can double check. On the best of my knowledge, it hasn't changed, but I need to double check on that for you.
Does the 85% bed occupancy, does that sound correct? Or is that like way off from what you know? Chris?
Sorry.
The 85% bed occupancy rate, is that in the ballpark of what the board should be considering, or is you have no idea?
I don't. And that's completely up to you guys.
No, I'm looking for direction from the health department to say, listen, healthcare capacity at 85% bed occupancy is ideal, so we can make decisions. But we do need a weigh-in on what the ideal state of the healthcare system is.
Yeah, I'd have to get back to you on that.
Would you be able to get back to the board on that before, ideally our next meeting? Because I don't want the advisory to go on indefinitely, if that makes sense.
Yeah, no problem.
All right, thank you, sir. So
Chris,
that was,
could we also, sorry.
no, I was gonna say, Andrew, that's all I had for our discussion point safety measures. So who's next? And Andrew, that's you.
Okay, Chris, could we also get numbers, not just 93%, 94%, numbers of like, oh, there's 100 beds and 93 of them are being used? Because I'm just trying to factor in how many beds are not available now because they can't get the staff to be able to have those beds open with all the nurses that you've seen fired for refusing to take the vaccine.
Sorry. That information is on the website that we already sent. It's a moving target. So that's really not something that we could predict.
So you couldn't give any numbers. Today there was 1,000, tomorrow.
No, you could look it up on the
website.
website, but again, that we sent out, but I don't have that information in front of me now.
Okay.
We
I'm
have
just
to deal
asking
with,
for it to be read at the meeting so that people that literally, the elderly that just watch the meeting while they're in the nursing homes can know, rather than not everybody can jump online and look this stuff up.
yeah, I think Christine's question is, the hospitalization rate, and as far as whether that's an issue when we look at, implementing stricter safety measures across the town. And I think that I don't understand the direction that you're going in. I mean, I think it's a strict data point for us if we look at it, whether this area is in a danger zone and doesn't have hospital beds, then we have to make that determination that we need to do stricter safety measures. I think it's a strict metric that we're looking at, and data points that we're looking at. I mean, whether there's hospital beds available or not. I mean, I think that's the question. If there isn't, then we need to put in stricter safety measures going forward.
If it helps, and Kevin, and Chris, I'm referencing the COVID-19 interactive data dashboard for the
Mhm.
Massachusetts Department of Public Health. So that one, allows you to look for each day where the percentages are. And I believe that, that gets reported from the hospitals. So open-minded to using something else. I just feel like that dashboard's the best one, that for myself personally has helped me kind of feel confident in making decisions on this board.
Yeah, I just don't see how adding another piece of data would be hurtful in any way, and why we wouldn't want to provide the residents of Abington with more data on this.
This one I think is at the state level, the dashboard. So because it's at the state level for Massachusetts and it is broken down in like geographic regions, I don't know that our Abington, sorry, Chris, if I speak for you, I don't know if our Abington Department of Health has that type of leverage to change what the state's doing, unless they're going out.
It's not,
Yeah, I'm sorry. Maybe I'm not understanding. I'll listen.
it's not changing something that the state is doing. It's reporting the total number and used number of beds rather than a percentage. It's just like Marty's saying he's not going to count Abington deaths. He's just going to go with Plymouth County. It's the same thing. In theory, it's the same thing. You're reporting a number that is set by the state or the county.
Can I jump in
as
there?
opposed to Abington.
Please.
There are definitely limitations with the data locally, especially when it comes to hospitals, because Abington people are going to go to different hospitals across the area. So in separate counties. So we have access to hospitals in Plymouth County. We have access to hospitals in Norfolk County. So I just don't think that Abington Health Department is going to be able to come up with that kind of metric. Like, we are going to have to rely on the state data, and that's something that we can get by going online. And quite frankly, I don't think it's the health department's role. I think we can all do our own individual research online and find that information to come to the board with. So we don't need to put that burden on our staff.
Agreed.
Do we have any other special points in the board on our COVID-19 safety measures?
I'll make a motion to keep for the next 2 weeks the same safety measures that we've had in place.
Okay. Do we have a second?
Second.
Okay. I apologize, guys. I'm chairing and my Robert Rules of Order. So we have a motion and a second to keep the COVID-19 safety measures, the advisory in place as it has been. Because it's a Zoom meeting, we do need to vote for a roll call vote. So roll call for the vote. Kevin?
Yes.
Melissa?
Yes.
Andrew?
No.
And then myself, and I'll vote yes. So the motion passes to keep the advisory in place as it is. Do we have any other motions, comments, or feedbacks on the topic of the COVID-19 safety measures? Okay, so hearing none, we'll consider this topic closed, and we will move on to the next item on the agenda, which is old business regulation review. Let me pause. I forgot. I'm sorry, Andrew. You wanted to make a motion between our agenda items.
Yes, I would like to make a motion to table the tattoo agenda if there are no local at Town of Abington tattoo shop owners or person that runs the business, whatever. If there's none of those people on the Zoom call with us, I'd like to table the tattoo regulation agenda item.
I'd like to offer a discussion point to that motion. Currently what we're looking at today is specific to Section 2. It has been provided to the establishments. They have been given the opportunity to respond, and we've kind of tabled this multiple times in the past. And I'm concerned that we're not going to be able to get through the regulation by the time some of our board members' terms come to a natural close. Because part of our project plan is to allow a full review by the practitioners, which includes Section 2, there is the opportunity for those practitioners to review Section 2 at a later time. So I would rather, this is just my opinion, of course, because it is up to a board vote. I would rather us move forward on section 2 tonight, so that we can try to get through this regulation in a timely process. Is there any other discussion points or any other motions from anybody else on the board? Or I apologize, discussion points or seconding Andrew's motion or another motion?
I'm in favor of tabling it, but not for the reason that they're not here. If they were invited and didn't show up, that's a different story. So I'm in favor of tabling it only because there's also a motion on the floor to end this meeting right now at 6:30.
Okay, so we have a motion to table it and we have a second, so we'll do a roll call vote. We'll start with the person that motioned it. So for the vote, Andrew?
Yes.
Okay, Melissa?
Yes.
Kevin?
Yes.
And myself, I'll vote no. Okay, so the motion passes to table the lifeguard regulation to the next meeting. All right, that brings us to our last bit of business, which is the approving of the minutes.
With it being 6:30, I would like to make a motion to end the meeting now as the health department is no longer here. Aaron is not here and I have to leave myself.
You want to make a motion to adjourn, is what you're saying?
Yes, I do.
Okay, so we have a motion to adjourn. Do we have a second?
I'll just add a discussion point there. Aaron was supposed to come back to the meeting, giving us an update on the conversation with the health department about the minutes. So if we don't have that information from him, I also agree to table that.
Yeah. I haven't seen the updated minutes as yet since the last meeting.
Okay, I'm getting a little confused. I'm sorry. I think we have a motion to adjourn the meeting and
Yes.
then have a second to adjourn it.
Right.
Okay, so we have a motion to adjourn. We have a second to adjourn. Roll call. Andrew voting on adjourning the meeting at this time.
Yes.
Kevin,
Yes.
Melissa,
Yes.
and myself is a yes. So the motion passes and the meeting is adjourned. Thank you all. Andrew, thank you for hanging on for another 2 minutes. I appreciate it, knowing you had a hard
Thanks,
stop.
Christina.
Right, everyone have a great night.